Hello and a very warm welcome to this week's ISNTD Connect. My name's Marianne Comparet. I'm speaking from the International Society for Neglected Tropical Diseases here in the not so sunny London. And it's a real pleasure to welcome everyone connecting and to have the chance to welcome you to this really exciting session today, taking a closer look at the next steps in research and development for neglected tropical diseases. We're very grateful that you've made time for this ISNTD Connect session, which is a bit earlier than usual, first thing in the week. And that is quite befitting because time is of the essence. On the one hand, we can't reiterate enough that research and development for NTDs has historically been in great disproportion with the global burden and the number of individuals and communities affected. But then on the other hand, we do stand at a really exciting point around the halfway mark to quite ambitious elimination goals for 2030. 54 countries out of a target of 100 have eliminated at least one NTD so far. And so to support these and many other goals across more than 20 diseases, across nearly every continent, this is really an important time to reflect on what the next stage of research and development for NTDs should look like, where the focus should be. Has progress been uniform across the diseases and regions? Where are some of the steepest knowledge gaps or the most urgent needs? And what about the diseases that have been more recently included on this NTD list? Where do we stand for research and development on those? So against this backdrop, it's my immense pleasure to share with you and welcome our speaker from WHO, Dr. Anthony Solomon. I'm sure many of you have seen that the WHO's Global Neglected Tropical Diseases Program is developing an R&D blueprint for NTDs and welcoming inputs from a wide range of contributions from yourselves and lots of other partners and stakeholders in this field. And to tell us a little bit more about this consultation, or importantly, answer your questions and hopefully how and under which form you might want to be involved. We're really, really pleased to have Dr. Solomon with us here today. Sol, I'm sure that many of those on the call, if not everyone, will not need an introduction. They will know you very well, whether as chief scientist at the WHO's Global NTD program, through your work in Ghana, Tanzania, but also as medical officer for trachoma and consultant physician in tropical diseases. So we all know you very well. We're really pleased you're here today. And so without any further delay, I'll hand over to you to tell us a little bit more about this R&D blueprint. And for all of those tuning in who are on the call, please, I see you've started to make use of the chat function. Definitely say hello, introduce yourselves. Celestin Mudogu, Alain Claver-Quamin, welcome, Nancy Sabuero. But also any questions you have, please don't hesitate to post them there. And after a short presentation, we'll be opening up for discussion and Q&A. Without any further delay, over to you, Sol. Thank you very much for being with us today.
Marianne, thank you very much. Thanks for having me. It's a great pleasure to be with you in this forum. As you mentioned, we're developing a research and development blueprint for NTDs, and the NTDs are likely not to need much in the way of explanation to this audience, but perhaps just to note that NOMA is the most recent addition to the list, added to the WHO NTD list in December of last year. So, of course, not currently part of the roadmap 2021 to 2030. Many of you will have been involved in the process to develop that roadmap, which took place over 2 years from 2018 to 2020. It lists cross-cutting and overarching and disease-specific targets for 20 of the now 21 NTDs. And the link to the roadmap is at the bottom of that screen in case people do not already have a copy. As far as the overarching targets go, there are 4 of them in the roadmap. The first one is a 90% reduction in the number of people requiring interventions against NTDs from a 2010 baseline. And as of 2022, we'd collectively achieved a 26% reduction. And I think it's probably worth noting that that graph on the right-hand side of the screen is somewhat cut inappropriately in its y-axis, giving the impression of tremendous progress approaching success, whereas in fact we are not currently on track as a community to meet the 2030 target. The second overarching target is a 75% reduction in NTD-related disability-adjusted life years. And in fact, we've not been able to recalculate the daily burden since the roadmap was generated, because we only generate sufficient data for 14 of the 21 NTDs at the moment. You mentioned this in your introduction, Marianne. The third overarching target is, of course, 100 countries having eliminated at least one NTD, and we are now 54 hundredths of the way there. So that overarching target is progressing reasonably well. And the fourth one is to eradicate two NTDs. That's dracunculiasis, or guinea worm disease, and yaws. And we have not managed to do that for either. Guinea worm seems very close, but has seemed very close for a few years in a row. And for yaws, we're really at a bit of a loss to know exactly the full extent of the problem. There are something like 80 countries which were previously known to be endemic, which used to report data on yaws to WHO, but have not been able to do so for many years. So their current status is unknown. So far, only one country has been certified as being free of yaws. So we think that part of the way to hopefully get us back on track is to work smarter as well as harder. And in order to do that, we'd like to improve the landscape for research and development in NTDs, which at the moment is not as strong as it could be. And I'll just give you perhaps one or two examples of that. This is a slide showing the number of publications in PubMed, with the top panel being publications on trachoma, and the bottom panel being all papers in PubMed from 1891 to 2023. You'll see that in that bottom panel, that's the columns in green. There were 2,480 papers listed in PubMed in 1891, and something like 1.7 to 1.8 million papers each year for the last 3 or 4 years. So a gradually increasing body of work being done in medical research. The top panel on trachoma shows that we peaked at 120 papers in the 1950s, and since then global output has declined, despite the fact that we've committed as a global community to eliminating trachoma as a public health problem worldwide. So we're not doing enough research overall, I would say, on the basis of that very superficial look. And you could get a bit more detail about specific deficiencies in the pediatric R&D landscape for NTDs in this report, which was launched in November. Either that short URL in the bottom right corner or the QR code will take you directly to that publication. So there's not enough research. We often don't ask the right questions, and our research and development programs overall are probably not very well coordinated. And so we're trying to do what we can to fix that through getting the community together and trying to work out what our collective priorities would be if it was an ideal world. And that's where this thing comes in, the research and development blueprint for NTDs. We intend it to be built by the community, for the community, where that community is defined as everyone who works in NTDs or is affected by them. The process that we plan to use, that we are using for doing this, is a thing called the CHINRI methodology, CHINRI standing for Child Health, Nutrition and Research Initiative. It's a process that was specifically designed to answer or do a research prioritization exercise for child health and nutrition, but has since been adapted and used for lots of other technical areas. And we think it will serve the purpose that we need for it very well. The principles that we're trying to inculcate for our adapted CHINRI process are to be as inclusive as we possibly can. And that means including all relevant stakeholders, including people affected by NTDs, transparent to the greatest possible extent without divulging personally identifiable data of the people who contribute, to be systematic, to be democratic rather than being dominated by the people who are prepared to talk the loudest or argue for the longest. As simple as we can make it, and as a consequence of all of that, in theory, it should be reproducible. And all types of basic, applied, and implementation research are eligible for inclusion. Essentially, if you can think of a problem that needs to be solved in NTDs that has not yet been solved, it is in scope. The process has a number of stages. We've developed criteria for including questions against which we will ask questions to be scored later on. We're undertaking now a process of stakeholder engagement, including, of course, this webinar. I'm leading up to an ask from all of you. We'll then undertake question development, ask the community to score those questions, and that will allow us to rank them. And then we'll publish and disseminate the R&D Blueprint and follow up to adjust things as time goes on, and hopefully to make sure that information is used for decision making by researchers, by funders, by national programs when they're deciding what research to support. I've mentioned that we want it to be inclusive. That inclusion includes people affected by NTDs, the frontline health workers, funders, NGO staff, people who do research, and health ministry officials at every level, from ministry people in national capitals to people on the front line. What we're going to ask people to do is register their interest with a link that I'll share with you in a moment, and then in a couple of weeks' time to submit research ideas. So that's really any problem that you think needs to be solved for NTDs. The Secretariat will, with the help of some social scientists, undertake a process of thematic analysis to form fully developed research questions that will then send out to the community for scoring, as I've mentioned. So that's very briefly the process. I won't go into it in too much detail. I'm very happy to answer any questions so that I tell people what they actually want to know. Again, there's a QR code there that will take you to the page, or a short URL you can copy down, bit.ly/rdbpntd. And that's it for me. That's my email address in the bottom right corner. If people want to contact me about it, ask questions, I can do that now or via email. So Marianne, thanks again for the opportunity to bring this to the attention of your very esteemed audience.
Well, thank you very much, Sol. That was a very clear introduction. I think you really reminded us very starkly of how much more work there needs to be done in research and development in NTDs. Working smarter, not harder, a great motto for what's to come. So if anyone in the audience has questions, please, it's going to be over to you in a few minutes. But I think the thing that really shines from this endeavor is the fact that you are really calling on input from anyone who feels, as you so nicely put it, that they can think of a problem that needs to be solved in NTDs. So could you tell us a little bit more about exactly who can come forward? Is it a very daunting process? What might be the time commitment? Like, if I'm sure you've motivated a lot of people in the audience to think, well, I have actually got a few ideas. What do I do next?
Thank you. Yeah, so so far we have 700 people who've registered to contribute, which is excellent. There's a lot of expertise out there, so the more we can encourage people to join, the better. And by people, I mean people who have had personal experience of having an NTD or have been treated for an NTD. So sometimes people are not necessarily affected, but are involved, for example, in receiving mass drug administration for control elimination. Health workers at every level, whether that's community health volunteers, community health practitioners, doctors, nurses, physios, dentists, people who have managed patients, looked after people who have NTDs. Researchers of all kinds, whether they work at a university or for another kind of non-profit institution, or if they work for industry. WHO is often a little bit allergic to dealing with people who are working for profit-making businesses, but we recognize as part of this exercise the importance of pharmaceutical companies, for example, and diagnostic makers. So those people are not excluded. They are, to put it more simply, they are included. You will be very welcome. People who work for health ministries, people who work for funding agencies and have experience of thinking about questions from the side of what will we fund. And in order to kind of use those data in the best possible way, we'll be very open about saying these are the questions that were prioritized for disease X by stakeholder set Y. So for example, these are the questions that are prioritized for NOMA by people who are affected by NOMA, and these are the questions that are prioritized for NOMA by researchers or by funders. And these are the questions that are prioritized for NOMA overall, so that when people are making decisions, they can use the data in the best way that works for them. In terms of commitment, it's probably going to be a couple of hours per theme, per disease or disease group that you choose to contribute to, but spread over a couple of months. The most annoying hurdle is almost certainly the first one, which includes a standard WHO Declaration of Interest form. And for many of the people who work on the front line or who've been affected by NTDs, questions about whether or not you hold stock options that will be advantaged by your participation in this exercise are not relevant. But unfortunately, I have to include them, and I have to include them in the standard language, which is somewhat difficult for many people because they're not concepts that are perhaps used every day.
That's actually a really interesting point. I'm sure that you would love to boost actually the participation of those affected by NTDs, also the communities they live in, and that was a good example, the stock options. So is there something specifically that those in the audience can do in addition to submitting their own expertise, but to perhaps reach out to the affected persons they know or have worked with? For a disease like NOMA, it's been phenomenal because kind of at the same time as an advocacy effort, there's also been a real effort to support and include affected persons, maybe other diseases less so. Do you have any advice for someone who would like to have more affected persons involved?
Yeah, I would encourage it, and if I can help in any way, that would be great. I imagine, varying by disease, there will be a range of education levels of people. Often NTDs affect the poorest and most rural members of our collective society. And as I say, some of the language is a little bit difficult. So some people may need a little bit of support to wade through the WHO Declaration of Interest form. If you're able to help your contacts who have been affected by NTDs to get through that process, that would be very much appreciated.
Yeah, brilliant. A couple questions have come up from the audience, Sol. So one by Maya Kavanagh-Williamson, and I think you've touched on some parts of this question, but Maya's asking, what are the expected timelines for the different stages of the process? And when will the final document be expected to be ready? So,
as I think you kind of alluded to in your introduction, we had initially imagined that the stakeholder recruitment process would complete this week, in fact today, and that's what it says on the website. I will extend that. I'm not able to extend it today because my web person is currently on leave, but the earlier we can get people to sign up, the quicker we can move forward. It's going to be over the next couple of months, as I say, and I would expect that by the end of the first quarter of next year, we'd be approaching a draft final document that can be shared in the community and commented on.
Fantastic. And if anyone would like to go to the website or follows the QR code that Sol shared, there is also a breakdown of actual dates, suggested dates at the moment on that webpage. I'll put it in the chat in a few moments. A question from Professor Russell Stothard. Thank you, a good consultation process. As a suggestion, will you time frame the suggestions, example, within 5, 10 and 15-year periods, as some priorities will be more time dependent than others?
Thank you, Russ. Yeah, great question. Yes, we will. So we're going to essentially complete the blueprint with 2 time periods in mind, and some of that kind of finessing will become apparent as people go through the process. But to firstly ask people to answer with a 2030 time horizon, and then answer again for a 2045 time horizon. Because of course, as many people will appreciate, development of tools, which is an important but not the only important part of the research and development landscape, development of tools like diagnostics or vaccines, therapeutics, insecticides often takes 10 years or more. And we recognize that not even if we had a perfect R&D landscape now, we would not get rid of all the NTDs by 2030. So there will be work to do after this decade finishes.
And I had a little look at the form that one would need to go through, and indeed it really covers, just to like reiterate and stress that, it covers contributors from all different aspects and the whole ecosystem around NTDs. And if you don't fit into any of those, there's also a category none of the above. So there really is no excuse to not engage with the process and submit at least some ideas, put yourselves forward. And maybe just to round off our discussion, if there aren't any more questions, from what you've seen, Sol, from those impressive 700 contributions already, are they quite nicely spread out across diseases, or is there still neglect and inequality even within the NTDs? And sorry. And if so, which ones would you really like to see more contributions from?
Yeah, honestly, I don't know. That's an exercise that we're doing today, actually, to look at what we've got in terms of people who have signed up by disease and by WHO region, so that we can kind of specifically then go out and say, well, look, we don't have enough people who have expertise in SDH in the region of the Americas, for example, and we should be concentrating our recruitment drive there. I'll know more, hopefully, by tomorrow.
Fantastic. Well, people often ask me, how many people attend the webinars, and I do answer slightly tongue-in-cheek, but it's also true. It just depends how neglected a disease the topic of the day is. So I don't know if that will correlate through those submissions, but hopefully not. We'll see a much more uniform range of submissions. Well, in the meantime, 2 more questions have popped up in the Q&A box. A question from Lisa Gowing-Adima that I'll read out in case not everyone is on the chat. We would very much like to engage our beneficiaries, like persons affected by leprosy, directly. Do they need to fill a form, or can they work through other stakeholders? Most of them may not have internet access, and actually that's a really good question. What if someone wants to submit, but they're part of like a consortium or a collective of people working on a disease? Do you prefer someone to be an ambassador, or would you rather have individuals putting in their own submissions?
Yeah, thank you. That's a good thing to bring up. I very much would like to have people contributing as individuals, and there's a range of reasons for that. One is that we want to get novel ideas, if novel ideas are out there, and the best way to do that is to have people thinking independently by having as many independent thinkers as possible putting their brains to this. A slightly more prosaic, boring reason is that I have to manage the conflict of interest process so that WHO is happy with how we've done this, and the only way to do that is to get people to fill in the conflict of interest form individually, as much of a pain as that is. And then a third reason, which again is perhaps more to the benefit of the people answering, is that because there's a quantitative element to this in terms of a kind of voting process later on, if people answer as part of a consortium, this is what the people in my research group think, or this is what people in my country think, then effectively they're reducing their vote to 1/10 or 1/100th of a vote, alongside someone else in another lab or another country who answers individually, if that makes sense.
Yeah, absolutely. And we have two more questions that I find very promising. Not only are people thinking about the consultation, they're thinking beyond it. Nate Lee's asking, is there any scope of the blueprint beyond the 21 WHO listed NTDs, for example, leptospirosis? And Anna Jones asking, are the ideas structured just by pathology? Shouldn't there be an identification of NTDs through an integrated approach? Thank you.
So my area of my remit, as far as WHO is concerned, is strictly limited to the 21 NTDs. Mm-hmm. So we can't include questions about leptospirosis specifically, but we do have 4 cross-cutting themes that will be available to everyone, no matter which disease-specific themes they contribute to, and so that perhaps addresses a little bit of both of those questions. So if the question is, how can we manage NTDs in relation to other endemic diseases of local importance, then that can easily fit into one of those cross-cutting themes, for example. Yeah. And the cross-cutting themes are as identified in the roadmap.
And with the many working groups at WHO in the department also looking at disease in a slightly cross-cutting way.
Yeah.
Well, to round off our discussions, there's one last very important question from Professor Alan Fenwick, who's asking, hello, Alan, and also, is there a feeling that MDA is not achieving as much control as had been hoped? And I might add to that, and is that something that is this blueprint and consultation looking at to fill any of those gaps which may or may not be occurring?
Well, I won't express an opinion about whether MDA is or is not achieving enough, because I don't want to lead the group, and I think that would be a difficult question to answer in the space of the time that we have. But that is exactly the sort of question that you might put as a priority. What are the, if that was a question that exercised people, what are the things that we can do to make MDA more effective, or to investigate the effectiveness of MDA, or questions of that nature. So I think Alan, as usual, is on the right track. Please sign up and contribute that question.
Absolutely. Some more questions, Sol. So Nancy Sabuero is asking, is there a standard questionnaire to use, or do you conduct your own?
Well, it will be a standard questionnaire across the exercise. We are adapting the Chinri methodology specifically for NTDs, but it's a pretty well-trodden path in terms of the fact that this has been used for at least 100 research prioritization exercises that have been done in different technical fields in the past.
Yeah. And unless I'm mistaken, if you go to the link that is now in the chat, or the QR code that you kindly shared, there is a box there to immediately access the questionnaire and to have a look if you want to see what it looks like, and etc.
That's right, yes. Well, it's at least the first stage, the sign-up stage.
Yeah. And in some fantastic news, we have a message here from Jida Mohammed Asakin. Thank you so much, Jida Mohammed, for sharing your comment. I'm a person affected by LF, and I want to share my views in capital letters. Thank you. So please, by all means, get in touch through the link above, or if you have any questions, Sol's shared the direct email address. You can also get in touch with ISNTD. If anyone has any more questions, we will just feed them on to you, Sol. Ilian Dams from Nigeria is saying, apology, I joined late, but no problem at all, because this session has been recorded and we will share that with everyone, I think, as soon as we're done, because we've had no technical glitches and disasters. So the edit should be nice and quick. On that note, Sol, I don't know if you have some final words that you'd like to share before we bring this information session to a close?
Only to thank you, Marianne, for hosting me again, and to everyone for joining and for the excellent questions.
Yeah, absolutely. It's been a pleasure. It's a really nice way to start the week, actually. ISNTD Connect tends to come towards the end of the week, but it's been a pleasure to see everyone. We've had a really good turn up. There's clearly a lot of interest, and we're all looking forward to hopefully seeing you again to share with us the next steps and the first round of conclusions.
Wonderful. Thank you.
Well, thanks again, Sol. Thank you to everyone who joined, Irene Larbi, Kidisti Bobosha, Nancy Sabuero, and hopefully see you again very soon, online or in person. Samira Hussein, thank you so much. Looking for the shared link. We will get that sent out to everyone. On that note, have a lovely week, everyone, and we'll speak soon again. Take care.
Thank you.
Bye.
Bye.
Bye.